Good morning. Today I will continue on the topic of diabetes for Diabetes Awareness Month. And today I'll talk about some general but very important considerations for diabetics. These considerations are good for anybody who's diabetic or even pre-diabetic, because even if you're pre-diabetic, there are some complications that can arise from being pre-diabetic. So these complications can be decreased blood flow or decreased sensation to the limbs. What this means is there's less healing to the area, as well as there could be something going on and you don't realize it. There could be an injury and the body doesn't notice it, or there is an injury and it doesn't heal very well. So we want to prevent that injury from occurring, and there are a few ways to do that. So we want to make sure we remove as much pressure as possible. So taking a look at what could be causing pressure points and preventing that. What can happen is a cut can develop, or an injury in that specific area doesn't heal properly. Eventually it could possibly get infected, and worst case scenario, well, it could lead to an ulcer, which is a wound that doesn't heal, and the worst case scenario could lead to an amputation, and that is definitely not something that we want to get to. So trying to prevent it from even getting to an injury or a cut, that's the best way to start. First, let's take a look at proper footwear. So the proper shoes, they should fit properly and they should have enough support. So look for a shoe that has enough support, bend it through the middle, bend it at the heel. So it should be quite solid, that prevents any excess motion. Also look for the shoe that fits properly. So that could be an extra deep shoe, an extra wide shoe, so a shoe that has different widths that you can choose from, so that your foot will fit a little bit better inside the shoe. It's a bit more of a customized fit. Also look for a shoe that doesn't have any seams on the inside. So you want to put your hand on the inside of the shoe, check around the whole area, make sure there are no seams that could be irritating that area. Also look for areas that could be a problem. For example, if you have a bunion, look on the side, make sure there's a pocket like this, or there aren't any lines or extra material going right over the bunion. So something like this, if that was right over the bunion, that could be irritating it because it doesn't stretch as well, and it would cause the irritation right in that spot. Also, if you have clawed toes or toes that bend up, they could rub against the top of the shoe. So again, look for a deep shoe, or you can find a shoe that's soft on the top. It doesn't have any seams, even mesh, depends on what's going on, but make sure there isn't any pressure on that area. There are other features on shoes that could be beneficial depending on what's going on. For example, something called a rocker sole. This one has a rocker sole. It's nice and bent up through the front and helps propel the foot forward, takes pressure away from the ball of the foot as well. So that could be important. Looking at laces versus Velcro, sometimes laces could be better because you can adjust the laces depending on to customize where that pressure is, and maybe open up certain spots or help lock the heel in so that there's a little extra support around the heel. Things like that, but there are lots of different shoes that have different features that are more beneficial for whatever pressure that you're more susceptible to. Next, I'll talk about proper support. So proper support could be in the form of shoes, and it could also be the different support that you put inside of your shoes. So there's over-the-counter inserts. These are generic support that they give you a bit of arch support. Could have different features on it depending on which brand or which style you go with. In some cases, this could be enough. Just take a little bit of pressure away from different spots. Custom ones give a little bit more support, and specifically for your foot. So if you have a lot of pressure on one spot, it could be offloaded by adding material, taking material away. Lots of different ways to do it. Could be a lot of cushioning to give you a little bit more cushioning, take that pressure away. It could be a little bit more support. It really depends on each individual person. You also want to be able to find these pressure points before they get any more serious. So you want to look for any redness, callousing, which is that thickened skin, could look a little rough. Look for corns, which are basically a pinpoint area, a circle. There could be a little bit of a callus around it. And look for any pinch calluses, which is a line of thickened skin. So any indication that there could be pressure in these specific spots, and then try and find out where they're coming from. Areas to look out for are the very bottom of the foot, so the heels, ball of the foot, tips of the toes. Look in between the toes. You can look on the tops of the toes, tips of the toes, top of the foot, any areas that could be more prone to pressure. You also want to look at the back of the heels as well. So look all around the foot, make sure there are no signs of pressure. Now, if you have problems looking at the bottom of your foot, try and get somebody to help you out. So if you live with somebody, just make it common practice every day, get somebody to take a look at the bottom of your foot and all those different areas. If you don't live with somebody, you can take a look at a mirror. So have a mirror in front of you, have a portable mirror so you can put it on the ground and hover your foot above it. And in those cases, always try and get somebody to take a look at it. And it could be a professional. So you could go to somebody like a foot care nurse, podiatrist, chiropodist, get them to take a look at your foot and, regularly and they would also take away any pressure points like calluses, cut your toenails for you properly so that there aren't any injuries when you're doing things like that. So they would take a look at your foot and how at risk you are to an ulcer, and they'll give you an idea about how often that you need to see them. Could be monthly, could be every 6 months, every year. Again, it depends on how at risk you are to an ulcer, but they would be able to tell you that. Indoor shoes is another important consideration. It's making sure there's something on your feet and it's not just socks. So something with a harder sole. Reason for this is because it prevents your injury if you're running into something. So if you're stubbing your toe, it protects that a little bit better. Also, if you're stepping on something hard or sharp, protects you from something like that. And it also gives you a little bit more support, which I talked about a little earlier. Something else you might want to consider are the type of socks you're wearing. So certain socks will cause a ring around your ankle if it's a little bit too tight. So if there's less blood flow and less circulation, it can really pool in the feet. So if it's a little bit too tight around the ankle, then it'll pool. You could see a little bit of ring at the end of the day when you're taking your sock off. So something like a diabetic friendly sock, they have extra stretch around the top so that it doesn't leave a ring and it allows for a little bit of a better blood flow. So those are a few important considerations for diabetics. And if you have any questions, feel free to reach out and I would be happy to help.